Okay, would everyone please stand for the Pledge of Allegiance? Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. So welcome to the March monthly Board of Health meeting, March 2025. With me tonight is, to my left, I'm Dr. Drew Bunker, chairperson, sorry. To my left is Kathleen Savage, board member, and to my right is Viviana Cantano, board member as well. And then we have from the municipal staff, Lauren Buck, who's Director of Public Health, Michael Wells, who's Health Agent, Director of Inspectional Services, and Paula Supelvita, who is the Board of Health Clerk. Also in attendance, we have outside counsel for the City of Revere. So first, we will start the meeting by reviewing and approving the minutes from last month's meeting. So I'll just ask the other board members if they approve those minutes.
I approve the minutes as written.
I approve as well.
Great, me as well, thank you. All right, next is going to be the Public Health Communicable Monthly Report with Lauren Buck.
Thanks, Dr. Bunker. For March 2025, we actually had a pretty low burden of communicable diseases, so I'll skip right down to state and national public health updates. From March 10th, 2025, a press release from the Executive Office of Energy and Environmental Affairs states that all of Massachusetts is either in critical or significant drought conditions. Most of the state has a 8 to 13-inch deficit since last August. Revere, as part of the Northeast region, is in a level 3 critical drought condition. Winter snowfall and rain have not been enough to replenish groundwater levels. As the growing season approaches, it is vital that everyone continues to follow state guidance and local water restrictions to ensure water is available for all our essential needs. It is important to note that the Massachusetts Water Resources Authority, or the MWRA, water supply system is not experiencing drought conditions, and that is what supplies Revere water. However, private well users and other sources of water within the same river basins are impacted by the critical drought conditions, and it's important to remember that all sources of water, regardless of their location, ultimately draw from the same river basins. It is important for all users to do their part to conserve water. The Drought Management Task Force recommends fixing any toilet or faucet leaks immediately, using dishwashers rather than hand washing dishes, aggressively reducing indoor water use, and stopping all non-essential water use. Finally, just be extra cautious with outdoor fires, grills, and flammable materials while we're experiencing these drought conditions. Next, from March 11th, 2025, a clinical advisory from the Department of Public Health, the Federal Department of Public Health, was issued regarding the spread of measles in the United States. As of December 31st, 2024, there were 285 measles cases reported for 2024 from 33 jurisdictions, which included Massachusetts, New Hampshire, Vermont, New York City, and New York State. Cases were seen primarily in young people. Almost 90% of cases were unvaccinated or had unknown vaccination history. 40% of cases were hospitalized for isolation or management of measles complications. Massachusetts had a single case in an adult with unknown vaccination history who was a known close contact to a confirmed measles case during international travel. Unfortunately, measles cases continue to surge in 2025, with over 220 measles cases reported by March 6, 2025, by 12 jurisdictions, including New York City and Rhode Island. These data are evolving rapidly and are likely to increase over the next few weeks. The majority of the cases are associated with a large outbreak among unvaccinated young children in the South Plains region of West Texas. 32% of cases in West Texas are in children under 5. 45% are in youth between the ages of 5 and 17. 97% of cases are not vaccinated or had unknown vaccination status. The outbreak in Texas has received a good deal of media attention, which in turn has created concern in Massachusetts about susceptibility to measles among those traveling to Texas, traveling internationally, or generalized concern irrespective of travel. Vaccination remains the best protection against measles. The CDC states that 2 doses of the MMR vaccine are about 97% effective at preventing measles, and protection is long-lasting. That's it.
Great, thank you, Lauren. Next is the Inspectional Services Monthly Report with Michael Wells.
Thank you, Dr. Bunker. Inspectional Services Report for the month of March. On the Interior Housing Division, we performed 77 Certificate of Fitness inspections, 29 Certificate of Fitness re-inspections, 14 in-process interior complaints, 2 new interior complaints, and 2 pool and spa re-inspections. On the Food Inspection Division, we performed 36 routine inspections, 6 re-inspections, 9 complaint inspections, 1 pre-opening inspection, and 3 temporary food service inspections. On the Exterior Sanitation Division, we issued 35 violations for accumulation of litter, garbage, trash, and debris, 52 violations for overflowing dumpsters, 369 violations for improper placement of garbage and trash and bulky items, 6 violations for multiple unregistered cars on a private property, 2 violations for road and harborage, and 6 violations for unclean, unsanitary land, and 1 violation for snow ice pump, sump pump violation. That concludes the Inspectional Services Report.
Great, thank you, Michael. Next is the condemnation proceedings for 70 Highland Street. So I will ask the outside counsel for the City of Revere to present and speak.
Thank you, members of the board. My name is Attorney Anthony Brunco from D'Ambrosio LLP. I serve as outside counsel for the Office of Municipal Inspections. And I'm here before you to talk about the condemnation of 70 Highlands, to request in order to vacate the property issue and in order to secure the property issue, along with the finding that the property be found unfit for human habitation. So I'm just going to give you a brief summary. I'm going to give you the violations, the need for the condemnation, and then the next steps. I will note that we have the property owners in attendance this time, as well as the representatives. The city has had productive conversations with them over the last 2 weeks, and we think that this property is going to move forward. That being said, we still will ask for the condemnation. So this is a property where it is a legal 4 acting as an 8 over on Highland Street. So let me describe the setup. We have in the basement 2 units illegally created. The second floor creates 2 units. We believe those to be legal. The third floor would be 1 unit, and above that they have 3 units, 2 of which are 2 rooms, and 1 would be a main. So the city was alerted to this property back in December of 2024. Logistically, it took just a little bit of time to get inside. We had our inspection on March 6th with the full safe housing team. That was fire, electric, plumbing, building, and health. Myself, I was also in attendance. And then there was another inspection on March 11th. With myself and Michael Wells. So at that time, I'm going to walk you through the violations that we found. In the basement, there were 2 illegal units. There were not enough egresses. There was no fire protection. I noticed that there were a couple rooms made out to be children's rooms, and the ceilings were too low. So those units were created without permits, without any sort of zoning relief, obtained beforehand. And so that's a major issue, because it really precludes the building and the sanitary codes determinations where you're supposed to get a permit, so that the city can essentially approve the scope of work, approve that the work is going to be done safely, go ahead and get rough inspections, final inspections, and none of that was followed. On the first floor, those 2 units are legal, but we did see some violations there. We saw some new work in the kitchen. We also saw a vanity that was created. It was basically installed over a radiator with some cleaning supplies inside there, which was pretty serious. On the second floor, again, more new work, as well as a room that housed, I think, 4 or 5 large truck tires, rubber truck tires, which are a fire violation. And then on the third floor, there was 1 main unit, and then 2 other units kind of off the side of each, both consisting of 2 rooms apiece with locks on those doors. Lastly, outside, we did also have a steel fire escape, which there's no records of that having been tested, which is concerning, given that that is the main source of egress for several of those units. Now I'm going to call on Mike Wells. If there's anything you want to add, I know that you were there.
No, I think you covered it all pretty well, Attorney Brunco. The property owner was very cooperative, and their family representative was very cooperative with us as well, which is appreciated, and it goes a long way in the making this property safe.
Absolutely agreed. So what I do want to highlight is that all these violations I've read off to you, these are all violations of several sections of the building code, the fire code, and the health code, but especially section 105 CMR 410-630, which is in essence the condemnation provision. It states, and I'm going to read this out to you, that when you find violations like this in a property, they shall always be deemed conditions which may endanger or materially impair the health or safety and well-being of a person or persons occupying the premises. So given that, the Board of Health really has no choice but to issue a condemnation order for those specific units. So that is what's there. I want to give the status now. Like Mr. Wells said, we have been in contact with the property owners. You will hear from them. They'll speak after me, but I will report that having just conferred, all of the tenants have been removed from those illegal units. They have begun, I have checked Citizen Serve, they've begun pulling permits, and we just spoke. Next week, we'll be scheduling a remediation plan, which is essentially a roundtable meeting with representatives of building, health, myself, fire, and the property owners to sit down and figure out exactly what the next steps have to be to bring this property into compliance. So at this time, the relief that we would ask is we'd ask for a condemnation order to be issued specifically against the illegal units, so not the entire building. This would be, and this is laid out in my brief and in the order to correct, units 1 and 2, which are in the basement, and units 6 and 8, which are essentially the 2 small units upstairs on the 3rd floor. So even though we believe that the tenants are out, and you'll hear that I think they're out, not only does this cover the city and make a statement that these units cannot be occupied, but it also ensures that the property owners have the ability to secure the units so that no squatters can get in, no other tenants can get in, children. And in the event that any tenants were to come back, let's say that the tenants weren't evicted or the tenants had some argument that they should legally be there, this in essence says that they can't be there and then puts the owners on the spot to have the provision of the sanitary code, which requires property owners to put up condemned tenants. And so in essence, this basically protects any of those tenants if they were to come back as well. So I have attached in my filings a proposed order as well as a proposed finding. If after hearing all this testimony you agree and you will give the city the relief it asks, I would ask that you sign these documents today and I will get them served off. Any questions from anyone?
Hi, I do have a question. So the illegal units have been vacated, but the ones that are legal, can the owners stay there or no? They also have to move out until the property is in code?
They can stay there. So those units which are legal, those were signed. The construction of those physical units was signed off on at one point. We do have the building jacket which says that the 4 is legal. It's just that those other units were essentially storage space or kind of nothing space, and so for that reason we would need those vacated. But everyone else could stay.
Okay, thank you.
Reading your documents, it sounds like there were violations in the units that were the legal units still. So how would that affect the people living there at the moment?
So those, like I said, because structurally those structures were still there, you go up and you would still recognize it as a real unit. The danger is not as imminent. That being said, so part of what we'll be doing next week is we're going to be having a remediation plan meeting, and we're going to go through step by step exactly what permits have to be pulled, by what dates, when do the final inspections have to occur, and that will essentially keep the owners honest in getting those violations remediated.
Thank you.
So just to clarify, we're not condemning the entire unit or the apartment, just the specific units within the apartment. Okay.
Correct.
All right.
Essentially, this is a partial condemnation.
Yes.
I don't have any further questions. Anyone from the board? No. Okay.
Thank you very much.
Anthony. Yep. So next, we'll just open the floor or the microphone to anyone who would like to speak. It sounds like we have people from representation from the apartment.
My name is Manuel Madrigal. I'm a general contractor. For the past 25 years, I also held a license from the Department of Environmental Protection, which means cross connections, severe engineering cross connections. So that's my career. Also, I'm here because I'm their nephew. So I'd like to speak on their behalf. Once they came aware of the problem, they immediately reached out to the tenants, find homes for them, pay for the move-ins, and also pay the rent for the new place, as well compensate them with some money for the inconvenience. The reason being, if you guys wanted to come back to inspect, you guys are welcome to it at any given moment. Everything has been taken out except for the stove, except for the bathtub, toilets, and vanities. We secure a plumber as well as an electrician to correct the alarm system, which the smoke detectors, 3 of them are now hooked up to electricity. But the plumber came to apply for the permit, and they say no because it's too soon. They want to wait for the next meeting. Maybe we should pull all the permits at the same time, as well as the alarm system. So we secure an electrician to do that. But I told him today to hold up pulling the permit until we had the hearing to see which one is the best way to proceed in these regards. Which you say next week we can go over there, right. Correct? We also secure an structural engineer to look at the back stairs, the metal stairs, and then he can give us a certificate stating if they're in a good shape or not. Yeah. Right? Also, for the analysis, he will conduct the analysis throughout the building and come up with the best idea of how to approach this matter. But Mr. Torres and his wife are willing to do whatever it takes to keep the existing house, and then once we get together one more time, decide where to go from there. But one thing for sure, tenants are gone, safe homes, everybody's happy. And I just have one question for Mr. Bronco, if you can help me out. So from my point of view, being a contractor for the past 20-some years, and recalling the only time you are required to install a sprinkler system is when you are doing more than 50% of the work in this property, correct?
I believe so. I think we're going to let the fire department determine that. So I think it kind of depends on the type of work you guys do, you know, what's going to be done with other spaces and stuff. Yeah, sure. So the question was what type of fire sprinkler system has to go in, what type of fire protection system. So that's really going to be determined as we go through. So we're going to have this meeting next week. Plans are going to get submitted. You're going to let us know what you want the certain spaces to look like. And if that triggers certain code requirements, you know, like you said, like maybe more than 50% of the work, you might have to go up to new standards, right? If you're able to keep it under that 50%, then maybe you won't have to put certain things in. It's going to kind of depend on what plans are proposed, but we're certainly going to work with the homeowner, you know, to make sure all that's communicated every step of the way.
Thank you so much.
Yep,
Really
thank you.
appreciate that. So at this point, I don't think I have any more comments. I really thank you for your time and give us the opportunity to explain what's going on. And again, they're in a good faith to do whatever it needs to do to keep the house to the standards and up to code.
Thank you so much. Yeah.
Anytime.
Any questions from the board?
I just have a quick question.
Yep.
Okay, so when the upgrades are made, is it going to be 4 apartments or 8?
Only 4.
Okay.
So, so one more thing. The basement, we're gonna just pull permits and then we're 100%. We don't have any need for it. The ceiling is too low, nothing we can do, not even for the storage. We're gonna just pull the right permits after Wednesday and just disappear them. The second floor, again, we need to meet with the architect and he has the last say. But right now, we just wanna keep it as a 4-family, but bring them up to code, no doubt. And I'm physically not going to be doing the work because I'm too busy, but I am going to be managing the project from the beginning to end to make sure that everything gets done up to code and not cutting corners.
Great, thank you.
Thank you so much.
Yeah, appreciate it. All right. Anyone else want to come and speak on property?
I think we're all done.
All done, okay, all right. So I'll just put this up to vote. We have to make a decision about the condemnation of the units 1, 2, 6, and 8 within this dwelling. It's great that the family that they're going to make these changes and it's going to become a 4-family house, but it sounds like there should be a precedent that to condemn these units so to prevent people from using them in the future, this whole issue with squatting and whatnot. So I see the legal precedent to do the condemnation on these units, and I hope it doesn't cause any issues for the family in the future, and I don't think it will. But I'm going to ask the board members if they're what their opinion is and if they had anything to say.
No, I think unfortunately we do have to condemn those units, and it sounds like you have wonderful owners that are gonna do the right thing and bring the house up to
We like
code.
to condemn it,
Yeah.
yeah. And then once the architect come up with another, sorry. So we would like to condemn them for now until the analysis takes place. And then we will be meeting with him and whoever from the board and move forward.
Okay, that makes
Thank you.
sense. Yep. All right, so it
No,
just,
I agree also that unfortunately we do need to condemn it. We need to make it as a safe building for everyone to be living in.
And that's what they want. They want a safe home. You know, she's
Yes.
84, he's 81, the last thing they want is problems. So they like to do the right thing, yes, absolutely. Thank you.
all right, great. So can you guys just give a vote for the condemnation?
Yes.
Yes, okay. Viviana?
Yes.
Okay, and me as well. So that's going to be 3 votes for the condemnation from the Board of Health. And so we'll sign this for you, Anthony. But, all right, that's going to be it for the condemnation proceeding. So feel free to stay or you can go, anyone who's part of that.
So are we done here?
You're all dead, yeah. You can guys leave if you want. The rest is probably not of concern. Thank you. Okay, great. And so the next topic to be discussed is the license renewal for the chicken keeping. I'm going to hand it over to Lauren for this.
Thanks, Dr. Bunker. So as you all know, we have an urban farming ordinance here in Revere. And so every year we have to inspect and re-renew licenses for both chicken and bees. We'll do all 4 at the same time. We have 2 chicken keepers in Revere, 2 licensed chicken keepers in Revere, 2 licensed beekeepers in Revere. So I'm asking for you to approve the licenses of all 4 of the licenses I'm about to talk about. The first is for chicken keeping. It's for Carmela and Luigi DiCharia on 60 Howman Street. We did their inspection yesterday on 3/26, and they passed, and so our recommendation is that you approve the license. We also have another chicken keeper, Iphigenie Victorian on 93 High Street. Her inspection was on March 21st, and she passed as well, so we recommend that you approve that license. Finally, our 2 beekeepers, Aldo de Oliveira on 364 Reservoir Ave. We inspected twice. His last inspection was on the 27th this morning, and he passed, so we recommend you approve that license. And finally, Damian DeMarco on 202 Prospect Ave. His inspection date was on March 19th, and he passed as well, so we recommend that you approve all 4 licenses. Thank you.
Yes. So I'm here for the other board members. Do you guys approve? Okay.
Yes, I
Yes.
approve.
So yes from both, yes from me as well. Approve those licenses. Sorry. Next is going to be the license renewal for the beekeeping.
We did all
that.
4. Yep, we're good.
Yes. All right. We did everything. Great. So that will conclude this month's meeting. Revere Board of Health. Thank you.